Welcome to Infinite Bridges, a podcast powered by the ASD Project. The ASD Project is a student-led initiative that is working to fight the stigma surrounding autism spectrum disorder. We want to help students, parents, and educators understand ASD and feel empowered to make a difference in the autistic community. I'm Addison Kurtin, the co-founder of the ASD Project, and I'll be your host today. I'm so excited to welcome therapist and founder of The Wright Counseling, Stephanie Wright. Stephanie has a master's degree in counseling from Western Michigan University and has worked in hospitals, agencies, and outpatient clinics. Stephanie, thank you so much for being here.
Thank you so much for having me.
Of course. So let's dive into the first part of our topic for today, the ins and outs of therapy as it applies to autistic patients, their families, and the community. So you started your own private practice, The Wright Counseling, in 2017. You and your associates work directly with children, families, adolescents, and adults who are struggling with things like anxiety, low self-esteem, depression, and transitions through different stages of life. Have you worked with any patients with autism? And if so, how does providing care and support for these patients look different?
Yes, thank you. Great question. So I have definitely worked with children and adults with autism throughout my career, and I used to work in a clinic that focused really mainly with clients with autism. And now in our outpatient clinic, we are able to service clients in a different way. So different clients through different ages need different levels of support. And so I'm just going to speak to the outpatient space. And I want to be really clear with a disclaimer at the beginning that clients with autism that come to us are just human beings, right, with different challenges. So just like with any client that walks in the door, we're going to make sure that we meet them where they're at. We're going to make sure that we understand what they're looking for and that therapy is not a one-size-fits-all. So just because someone comes in with an autism diagnosis and is looking for support doesn't mean that us as therapists or any therapists out there know exactly what they're going to want. And so we need to be very mindful and cognizant of the fact that, just because someone has a diagnosis does not mean that they look the same as everybody else with that diagnosis. So with that said, a lot of times we'll talk about children first, right? So a lot of times children who are coming into an outpatient clinic with autism diagnosis will look for things such as behavioral intervention or learning different skills. Sometimes it's social skills, sometimes it's executive functioning. So those can look differently based on what the child is presenting with, what the family is looking for. And so the important part about outpatient therapy is to make sure that you're really asking the child and the parents what they're looking for out of the experience.
Yeah, that makes a lot of sense. And so, you often speak about how as a therapist, it's essential to meet people where they're at throughout their journeys. Could you provide some examples of how a therapist could accomplish this, especially for patients with autism?
Sure. So just like I said, you want to make sure that you're an open book when they come to you, right? In terms of asking lots of questions, seeing what they're looking to work through. What do they want? It's really important to check yourself with clients to make sure that you don't have an agenda for them when they come to you. And sometimes, with diagnoses that can happen, whether it's autism, whether it's a different diagnosis, sometimes depression, sometimes anxiety. We as therapists can sometimes have an idea of what that's going to look like. And so making sure that every individual that comes into your office is greeted and welcomed and received with who they are. So if we jump into adolescence, right? If an adolescent with autism is coming into the session, sometimes the parents have an idea of what they're looking for that child to learn or that adolescent to learn. Sometimes the adolescent might have a different idea of what the adolescent wants to learn. So it is really about communicating, making sure that that family is a unit and that they're working together, and that you're making sure that you're communicating that throughout the process. We do not know, as the therapist or clinician, what is best for you as the client that comes to us, right? I think a lot of times people make us out to be the experts in something, and although we have a lot of experience and this is our job and you're coming to us as a person that knows how to navigate some of these challenges, we are not the expert of you, and we're not the expert of the family unit or the child. And so we show up with our authentic self. We are a human in the room with you, with your child, with the family unit. And it's really important to be present with that, to have a lot of curiosity, to ask a lot of questions, not to compare, this client that's coming in with somebody else, because everything looks very different. And one client with autism might have a challenge, let's say with social skills with other kids, for example. Another child that comes in with autism might not have that same challenge. So those goals and the interventions and the strategies and the questions that you ask and the games that you might play or the things that you might learn are going to be different. And so you want to make sure that you stay present with that person in the room and that you're not kind of using social media or movies or different clients' experiences when you're present with somebody. You just do not want to assume that you know what they're going through because they have this diagnosis.
Yeah, that makes a lot of sense, that you really have to see what each client is looking for specifically. And it seems like many counselors have different styles or modalities for therapy. How do you as a counselor know which modality to use and how to implement it with clients with autism?
That is such a great question. There are a lot of different styles and modalities, and I want to even just break that question down a little bit, because one counselor can have maybe the same modality as another counselor, but their styles may be very different. And so when anybody is seeking therapy or services or counseling, you really want to make sure that that's part of the most important thing that you're looking for first, right? Obviously, skill set and experience and knowledge are really important, but first, you want to understand what their style is. So for example, at our clinic, when you call in for services, we do a really thorough question and answer screening to make sure that we know if it's a child, an adolescent, or an adult, what is their personality like? Who are they going to do well with? What are they looking for? Some people like a little bit more of a direct approach. Some people have a little bit more of a supportive style. And just because they might both do a certain modality doesn't mean that they're going to utilize that modality in the same way. So some modalities, for example, like if you take, I know you had asked me about EMDR, which is maybe we'll get into that later, but that's a very specific modality, and there is a protocol for that. So the structure of it is the same, but the way that the style that the clinician approaches it might be different. And so in order to understand modality, you really want to understand what the goal of the client is, and then you also want to assess for capacity. So with autism, sometimes you have different clients are on different, they call it a spectrum, right? So sometimes clients are on different ends of the autism spectrum, and so capacity might look different for that client in terms of what they're wanting to work on, what they're interested in talking about, what's comfortable, what's uncomfortable. And so more direct approaches or styles or more structured approaches might be better. Sometimes that might not be the case. So it is a clinical judgment, I would say, in the beginning when you're working with that client to understand what their capacity is and to be able to, again, meet the client in the capacity, because it's about helping them settle in, feel safe, be able to ask good questions, be able to get their needs met as opposed to what you think their needs might be. So that's a really important, and the best way to really do that and to assess kind of what you're wanting to do is to be present and to be open to learning about the person that's in front of you.
Yeah, it definitely seems like understanding these different styles is really important. And I know that you mentioned EMDR, which is something that you're trained in. Could you explain a little bit about what that is?
So EMDR is a trauma model that's aimed at processing trauma that's stored in the body. And so that's an example of whether you have autism or not, there's a capacity needed to do deeper models like that. So that might not always apply to any client that comes in. And so you want to make sure that you're assessing your client's ability to stay grounded. We say to stay in their body, right? So we don't want to work through something that was maybe a bit traumatic for them. We don't want to go there too fast. And so you really have to make sure that they're able to, I use the word grounded, and I guess what that means is really literally being able to feel your feet on the floor, being able to know where you are in time and space, be able to kind of control your heart rate and your rhythm and your breathing. And so sometimes, not just the autism spectrum, but since we're talking about that, if you have somebody on the autism spectrum that has a really hard time focusing or staying present with you or having eye contact, that's not going to be a good model for that. Maybe, and then the models change as well, right? So if someone is looking to come in and work on maybe learning how to stay focused and be present in the room, you might not need to do a trauma model processing, but you might need to do more of a skill-based, building the capacity to sit at a desk, or building the capacity to stay focused on listening to a lesson from a teacher, right, for example. And so we might work on, maybe the client comes in and it's a child and they have a really hard time sitting still. And so we're going to practice building their capacity to sit still so that they can learn about the lesson. And so we want to be able to make sure that we're doing that in the most safe and effective and helpful way for that person.
Yeah, thank you. That makes a lot of sense. And then this is something that I think you touched on a bit, but we at the ASD Project definitely believe that it's important for therapists to understand that autism is not a disease or a problem that needs to be fixed. It's simply a different way for the brain to process information. So keeping that in mind, could you describe what a neurodiversity-affirming approach to therapy is and why this is so important?
Yes, I love this question. I love that you named that it's not a disease or a problem. It really is. So neurodiversity is a buzzword right now, right? Everybody's using it. And I think it's great because it brings light to the fact that our brains all work a little bit differently. And so for clients on the autism spectrum that are labeled as or named or identify as neurodiverse, it really just means that their brain works a little bit differently than yours and than mine, right? And so what you want to do is you want to be able to, as a counselor, you want to be able to see that as a gift. You want to be able to see that as a strength. You want to be able to see that as how cool that you see this world this way, or this problem this way, or this situation this way, and what can we learn about that? And it's not something to be, quote unquote fixed. It's not a disorder, it's not a disease, it's not contagious, it's none of that, right? And so I think people that are, counselors, therapists that are working with this population are really excited to be able to be a part of that. And I think as more clinicians are more trained in it and more clinicians are more open to learning about it, it just makes the world, a bigger place for these clients. And so we really want to, and this is something that really we work hard on, is we don't want to pathologize it, right? So like pathology is that there's a disease or there's something wrong and that we're looking to fix it. And so autism is not pathological in nature. We don't need to fix it. Now, what does happen sometimes with autism, depending on where the client is on the spectrum, is their brain might work differently in a way that maybe does not lend itself to, it might lend itself to having a barrier some way. So if, I'm going to use social skills because I feel like it's really relatable for people. And so sometimes like kids or adolescents or adults with autism might have a different understanding or capacity, again, I use that word a lot, for different types of social skills. Social situations they might not read it the way that somebody else reads the scenario. So they might say something different, they might sit too close to somebody, they might misread a bodily cue from somebody else. And so we don't need them that's not broken. That's just something that they haven't maybe learned in that space yet, and we're able to help them learn what could be more helpful so that they can feel more inclusive or more included in that space. Does that make sense?
Yeah, that makes sense. And I really like that idea of seeing autism as like a gift or a strength as well.
It really is. I mean, it's sometimes the other thing people talk about when it comes to autism is that sometimes clients can have fixed interests, right? Or sometimes they call it rigidities. So there are a lot of, I'm going to speak to kids at this point, but there are a lot of kids that have autism that have like a really high interest in, let's say, sports, right? They might have a really high interest in sports and might really keep their attention. And so then they go to school, maybe they're learning about history, and maybe they're not as interested in that. And so they get distracted more easily, and they don't retain the same information the same way. But when you look at how interested the one topic is and how much information they can retain, that is a gift and that is a strength. And that's a huge to using that in a way to teach other, like how to have interest in other topics that might not be as preferred.
Yeah, definitely. And then the other thing I wanted to talk about today was the benefit of connection and how this can apply to autistic patients and their families. So to begin, on your website, you emphasize the importance of connection, especially for children and families. So could you speak a little bit about that?
Sure. Connection is just a human need, right? So this is across the board a huge piece of our work as therapists is to be able to create a container and a space that clients feel safe in enough to connect with us. Because what we're doing is we're showing up in a way for them that allows them space in some way to either learn something new, process something old, work out a problem, learn a new skill, whatever that is that they're coming to us for. But just think about like the last time you met somebody and you just were like, I don't really know if I want to be their friend, or I don't really know if I felt good at that interview, or I don't, there's a thing there that we feel as human beings when we're connected to somebody else. And so not all therapists, you're not going to connect with every therapist, right? So sometimes I tell people it's kind of like finding a pair of shoes and you have to try on a couple to find the right one. And so feeling connected means you feel like this person that you're sitting across from gets you, understands you, is safe enough to tell you, they are safe enough for you to tell things to. If you're working with somebody in a clinical role that you don't feel safe and connected to, then you're not able to really share the depth of what you're looking to get through or process or work on. I think authenticity is kind of a hot topic word now too, but like for such a good reason. And so as a clinician in the room, you have to show up as yourself. And I think sometimes newer clinicians get a little nervous about this, and there's a balance about being able to, we're not trying to be everybody's friend necessarily. And so there's this really nuanced space where you're providing, I call it a container. A lot of people call it a container, where that person is feeling connected to you in a way that's safe enough to share what they're looking to work through. So to bring it back to people on the autism spectrum, we heal and we learn through play and connection. So if you think about little kids, they learn through play. Teenagers still learn through play. Adults still need to learn through play, even though a lot of us have lost that. Some of us as adults have lost this idea that play is important. It's important no matter how old you are. It lessens your defenses. It opens up your mind. And so we want to make sure that we are creating that space where clients can feel connected no matter how their brain works. And I think understanding autism, understanding the neurodiversity of that, understanding each individual person that comes to you is really important, because you as the therapist, that's our job. It's not your job to feel safe coming in. It's our job to create the space for you to feel safe with us. And the other thing about connection too is the disconnection part on the other side. So sometimes autism can be really challenging for families, right? Sometimes kids can have really big behavioral disorder or behavioral acting out, and some kids can have really hard time following directions or following rules. And sometimes kids, I've worked with kids in the past who, it takes 20 or 30 minutes to get out the door to school in the morning because the right socks don't fit, right? Like that was somebody I worked with once. And so that can cause a disconnection sometimes, let's say between parent and child, because that's a frustrating thing to happen, right? Like it's not maybe something you need to look at as bad. It's just something that's different and something doesn't feel right for that child in that example. And so sometimes when individuals and kids on the spectrum for sure have like higher level behaviors like that, very often, it can cause a lot of like parent stress, it can cause a lot of adult stress, it can cause adult to adult stress in the home if there are two caregivers, right? And so when we don't repair and we don't spend time repairing and making more of an effort to reconnect with those kids or the parents together, then that can lead to maybe some frustration or maybe some anger or maybe some anxiety for that parent, right? Maybe we're in Target and our child is kind of having a meltdown, and so we get embarrassed, and so we quickly try to move on, and we disconnect from the human and the child, and we try to just kind of tame the behavioral stuff because it's bigger and louder and more embarrassing, right? And so in therapy, we want to make sure that we work towards teaching connection, creating connection, teaching parents about what that means, and no matter how big, we call these ruptures, right? So sometimes when kids hurt somebody hurts somebody's feelings, that can be parent-child, child-parent, it can be between siblings, it can be between a child and a friend. It doesn't really matter how big the rupture is as long as we can come back and repair it. So the repair is the coming back together. It is the reconnecting to that relational, the relationship that you have with those people, right? And that relationship and being able to kind of move through it. And so we are balancing the connection and the disconnection with parents and children a lot of times when we're working on that. And then adult to adult, working on disconnection to connection. And so we want to, a lot of times, sometimes when we have those big behaviors, they pull us apart, and sometimes the behaviors are even bigger bids for coming back together. And so when you do come back together, you feel a lot safer and calmer in your body, and that can be a space where learning can happen and growth.
Yeah, that makes a lot of sense, how connection is really essential for any client and how important it is for therapists and parents to really understand autism.
Yes.
And then, is there any other advice you have about how therapists, educators, parents, or friends could help people with autism feel more connected to their communities and to the people around them?
I will share, there are so many lovely resources. I don't know how big your audience is, right? But even in our little Metro Detroit area, there are so many great resources. And so it's really important, I think, this project that you are doing is so amazing because I know you're going to bring together people who are looking for some sort of need, and you're going to have this space, right, where people can find that. And I think sometimes families or adults or young adults, sometimes because some of the behaviors that can occur can be big, sometimes it can feel a little bit isolating. And so as a therapist working with families with autism or individuals with autism, I think it is really important for us to know what is available, who can we refer, who can we connect you to, who can we help build, how can we help build your support network? I think that's really important.
Yeah, all right, thank you. That was the last question I had for you today. Again, thank you so much for joining me.
Thank you for having me.
Yeah, of course. I feel like I learned a lot about how therapy and connection can apply especially to autistic patients and their families.
Thank you so much.
Thanks for tuning in to episode 3 of the Infinite Bridges podcast. Be sure to check out theasdproject.org to learn more about what we do and what we have planned. See you soon for our next episode.